Welcome everybody with you Dr. Magdy Abdurazik, consultant of infectious disease, hepatology and gastroenterology. Our topic today about to answer very important question. Can syphilis kill you? So to answer this question, we have to know that this disease without treatment as regards the tertiary phase of syphilis may lead to several complications after infection. At this stage, syphilis can affect multiple organs and systems, including brain, nerves, eyes, liver, heart, blood vessels, bones, and joints. Tertiary syphilis can also cause death. Late syphilis, one of three people who have syphilis that is not treated suffer serious damage to their nervous system, heart, brain, or other organs, which can even kill you. So, this stage can occur 1 to 20 years after the start of your infection. Primary and secondary syphilis can be cured if it is diagnosed early and completely treated. Also, secondary syphilis usually goes away within weeks. In some cases, it may last for up to 1 year. Without treatment, up to one third of the people will have late complications of syphilis. The first symptom of syphilis is a small sore called a chancre. The sore is often painless. It appears at the spot where the bacteria entered your body. Most people with syphilis develop only one chancre. Syphilis is a highly contagious disease that is caused most often through sexual contact. It is 100% curable if treated correctly with antibiotics. If your infection is left untreated, even if your symptoms goes away, it can cause very serious long-term health problems and even death. What are the health complications of syphilis? If you do not receive treatment and syphilis progresses to the last stage of the infection, you are at risk for life-threatening complications. Damage to your body gets worse the longer you have syphilis. That is why it is not important to get treatment right away. Untreated syphilis can cause blindness and paralysis and lead to problems with your heart, brain, spinal cord, and other organs. Diagnosis and test. Your healthcare provider will ask about your sexual history, including whether you practice safe sex. It is important to be honest during this discussion. Your provider can help assess your risk and recommend tests for other sexual transmitted infections. To test for syphilis, your provider will examine you and take a blood sample to look for signs of the infections. Your provider may remove some fluids or a small piece of skin from a syphilis sore and look at under microscope. The only way to know for sure if you have syphilis is by visiting your healthcare provider and getting laboratory tests. So, what about management and treatment? How is syphilis treated? So, your doctor treats syphilis with antibiotics. Antibiotics are a type of medication that treats bacterial infection. Used penicillin is the most commonly used medications for syphilis. So, how much medications may need you may need and how long you take it depends on your syphilis stage and symptoms. You must finish all your antibiotics even if the sore or rash goes away. it is important to contact anyone you have had sex within the last 2 years and let them know they should be tested. So, your doctor will test your blood after syphilis treatment to make sure the infection is gone. Uh, you can get syphilis again after getting treated. So, be sure to practice safe sex and get tested regularly if you have an increased risk of syphilis. Uh, so, to answer question, is a syphilis 100% curable? Yes. Your doctor can treat syphilis with antibiotics. Antibiotics will cure the infection, but there is no way to repair organs damaged by syphilis. So, what about prevention? So, how can I reduce my risk of getting syphilis? The only way to prevent syphilis and other sexual transmitted infection is to abstain from sex. If you are sexually active, you can reduce your risk of infection by always using a condom or dental dam during sex. It is important to use condom properly to lower your chance of getting the infection. Ask your sexual partners about their history and if they have been tested for sexual transmitted infections. If your partner has syphilis, they can reinfect you. It is important that they get treatment too. So, what is the outlook for people with syphilis? The antibiotics can treat syphilis in the early stages. Syphilis does not cause long-term health problems if you receive treatment early. Without treatment, syphilis can cause severe health problems. It can damage your heart, bones, eyes, muscles, nerves. It can be fatal. So, very important question. We have to answer it. Can I get syphilis again after I have been treated? Yes, you can get the infection again after treatment. That is why it is important to practice safe sex and get tested often if you have a high risk of infection. So, how do I take care of myself? Sexual transmitted infection cause serious health problems. They require immediate medical care from your doctor. If you receive diagnosis, it is important to complete treatment. Thank you very much.